They've just called through another trauma. It's a man who had a concrete slab, they think about 300 kilos at a work site, fall onto his upper body.
Emergency Dr. Glenn Harrison takes the case.
Let's get ready.
Just received a call, 29-year-old male who's got a severe head injury. He may well have skull and facial fractures, amongst spinal fractures as well. And that the risk is that he has severe bleeding on the brain.
Paramedics arrive with critically injured stonemason Michael. In excruciating pain and losing consciousness, they sedated him and put in a breathing tube so he would survive the trip to emergency.
He is on a ventilator, raises suspicions for us that he does actually have a severe brain injury, and so it becomes a
potentially life-threatening injury. Tim, we're going to have to flatten him down to get him across.
I'm just worried that he might have severe complications, including seizures and increased swelling on the brain.
Can you just have a look at his pupils? Just tell me what they're doing.
Equals to?
The pupils are symmetrical and equal at the moment. The warning would be if there's abnormal pupils size on one side, that is a big warning sign for us. And he would need to have urgent neurosurgery.
We're ready on 3, 1, 2, 3.
Good. Guys, happy to start your primary? Do the handover here? Yeah, that's great.
All right, everyone, this is Michael, found by his colleagues out in regional Victoria today at 10 a.m, receiving an isolated head strike with a 300-kilo cement sheet. He's got obvious head injury. The ALS guys have arrived on scene to find him agitated, combative, and unable to facilitate assessment. The injuries that we've been able to ascertain is a mix between penetrating and blunt force to the superior region of his skull.
Can I clarify his injury?
Yep.
The slab hit him from where? The front or the back? Or?
It appears right on top of his skull here.
Right.
He's also got a slight gash to his right eye as well. Okay. I've got photos of the mechanism at Sheila.
All right, good.
Michael was crushed when the cement slab he was installing fell onto him.
Looking at the photos, that's a significant weight that's fallen on his head, and that raises real high risks for this patient.
Okay. Primary survey, please.
And then so intubated, trachea's midline. He's got equal air entry to bilateral tummy softened on the head. 2 mils and quite sluggish.
Yep.
His head injury could be life-changing, but he may also have critical internal injuries, putting his life in immediate danger.
What images have you done so far, sorry?
I've done both sides of the abdomen as occlusive repeater.
Okay, so no free fluid, no pneumothorax, just an cardiac to finish off. Okay, we'll get our x-rays. Chest and pelvis, please. Yeah, thank you. Has everyone got lead on?
Yeah.
That's good. It's pelvis more than anything else. Thank you.
That's the best you're going to get, but you can clear it.
X-rays of the pelvis are unclear. CT will show the extent of Michael's injuries.
Need some suction in there.
We're not sure where the blood is coming from. It could be that he's bleeding internally. So we need to get him to CT as soon as possible to find out where this bleeding's coming from.
I just suctioned a whole heap of blood out of the mouth.
Nurse Liz has identified he's bleeding from his mouth. Uncontrolled bleeding is dangerous in a trauma patient, and so we need to stabilise him and get him to CT as soon as possible.
Oh, hi, it's Michelle from Royal Melbourne.
Michael may not make it. Dr. Michelle calls his wife, who's on her way.
All right.
Let's package for CT.
I told CT they're ready.
Dr. Glenn gets everyone moving. They can't wait a moment longer. Michael's life is in danger.
3, 1, 2,
The risks of taking Michael around to CT out of the emergency department for a patient that's unstable, that runs the risk of a patient becoming even more unstable.
Right, now's the waiting game.
Worst case scenario now for Michael is that he's got significant swelling and pressure within his brain that requires going to theatre urgently.
He's got traumatic frontal blood with probably a contusion. He's got some facial fractures, same side.
So looking at Michael's scans, he's got significant injuries to the bones of his face and the frontal bones of his forehead. He's also got bleeding on the brain and bruising of the brain. And so they're significant injuries. I'm worried those injuries will get worse with more bleeding and more pressure in the next couple of hours. We need to make sure we're looking after his pulse and his blood pressure. All those things will help prevent secondary brain injury.
All right, we're back.
29-year-old stonemason Michael has just been scanned for potentially life-changing injuries after being crushed by a 300-kilogram block of concrete.
Just wondered whether he just moved.
To keep Michael safe while they wait for the CT results, it's vital he stays fully sedated.
Yes, he's moving. I might just bump this infusion up.
But he's waking up.
Yeah, he's not liking that. Yeah, I was going to bolus him.
Michael, you're in hospital. It's okay.
It's important we keep Michael stable and sedated on the ventilator.
I've just bolused him 50 of probes and I put him up to 120 an hour.
We're on the risk of him pulling out his intubation lines and his IV lines, and so that's a real risk for him.
Yeah, much better.
All right, we're winning.
Cool, well done. Good troubleshooting team.
With Michael now stable, his wife Tegan can be with him.
It's no doubt the worst day of my life.
We've been together 13 years. He's my best friend.
For Tegan, it's an agonising wait to see if her husband will ever be the same.
We have a 3-year-old daughter, Minnie. And he's a really good dad. She's everything to him.
Dr. Glenn can now see the full extent of Michael's shocking injuries.
There's certainly extensive fractures through his face that'll probably need to have something done from the plastic surgeons. We can see here that there's bleeding in the frontal lobes here on the right-hand side of the brain, and we can see that there's probably a little bit more blood underlying that area between the skull and the actual brain tissue. The big thing that we do see here, that bruising on the brain.
There's lots of different ways this may manifest. So Michael may have some difficulties communicating, and there may be seizures. So what's next for Michael is really a period of time in the intensive care unit. Michael's brain injury is potentially serious, and time will tell with further testing, but Michael's not out of the woods just yet.
Stonemason Michael's head was crushed when a 300-kilo concrete slab fell on him.
Right, now's the waiting game.
Scans revealed he had multiple fractures to his face.
We can see here that there's bleeding in the frontal lobes here.
And so there's significant injuries.
Doctors were concerned Michael would have life-altering disabilities. After only 12 days in hospital and surgery to fix his facial fractures, Michael's home with his family.
Conversation I had with the doctor, he explained the scenario. I said to him straight, how am I alive? Because I knew the weight of the stone. And the doctor said to me, you're a very lucky man. And yeah, so my main fear was what would be the future from those injuries. When I can go back to work, I'm definitely going to be working a lot less. I think an incident like this is what I needed to actually change my priorities in terms of work and life balance. And yeah, definitely want to spend more time with my wife and daughter.
She tipped the whole bubble container on what she was wearing.
For Kinder. That doesn't surprise me. Does she want me to come and pick her up today?
Yeah.
Well, the treatment I received in hospital was amazing because they definitely saved my life. And yeah, that's pretty much all there is to say about it, really.
An air ambulance is touching down with Dr. Luke's first patient, a critically injured father of 3 from country Victoria. Dr. Luke suspects 37-year-old Dane is in a bad way.
Tree loppers and arborists and tree fellas, they always seem to have quite significant injuries.
We might get him over the bed. It's a bit bigger, so if he does, we can roll him safely.
Helping to care for Dane is emergency nurse Elle Greenwood, who has both nursing and paramedic degrees.
Okay, we're going to go towards your left now. And 1, 2, 3.
I always feel like when I go home, I've made a bit of a difference and I feel quite fulfilled.
Sorry, mate, a bit bigger bed for you.
And if it was someone that I cared about and I loved and they were lying there, I would be making them comfortable. So it's quite important that we get on top of that because he's in so much pain.
Dane is a tree lopper. He's been at work today, has been cutting down a tree approximately 1.5 metres in diameter, and it struck him on the head from height. Significant damage to his helmet. The tree's then fallen onto his left shoulder.
The information from the paramedics that it's actually a whole tree that has hit Dane. And having a look at Dane's helmet, there was a really significant amount of damage to the helmet and a piece of wood just sticking out of it.
Yeah, pretty impressive, hey?
So I was amazed that he was awake and talking to me.
So man, I'm Luke, I'm one of the emergency doctors.
Yep.
How's the nausea?
Still feeling nauseous? You gonna vomit?
It's really important with nausea for someone lying flat in a collar that we get on top of it quite quickly because it's quite dangerous. If Dane was to vomit, that vomit only really has one way to go and it's up and back in.
Let me know if you are and we'll give you a roll to the side, okay?
The father of three's worst pain is in his left shoulder.
That's the shoulder.
I'll have a look.
Sorry, mate. Is it further up here in the back or is it lower down as well?
No, it's... yeah.
What about through the elbow?
No, that's all right.
Okay. This is the most comfortable position for you?
Oh, no, my shoulder's killing me at the moment.
Okay. We'll give you some pain relief because we're going to have to roll you in a minute.
Have you had fentanyl before?
I want to make sure that he doesn't have any injuries to the back that I can't see. So we know that he's got a piece of wood sticking out of his helmet. I want to make sure there's no wood sticking out of his back.
Big breaths.
He was really, really tender to touch through his scapula.
I'm wondering whether or not you've damaged your scapula, so your shoulder blade. Maybe that's where your pain's coming from and why it hurts so much to move your shoulder.
He's probably broken it. Yeah, his scapula.
All right, we're rolling back. And 1, 2, 3.
Bit of a lump in your back, okay? We'll get you a bit more comfortable first.
Yeah,
I'm just going to straighten this arm for a sec. Do you reckon it'll straighten there for me?
The amount of force required to fracture a scapula means that he's had a significant amount of force transferred through his chest. And so Dane's at risk of having potentially life-threatening chest injuries.
Did you see the bruising on him when we rolled in then? Essentially a whole tree fall on his head. That's, yeah.
Back in Trauma Bay 1, tree lopper Dane may have multiple broken bones after a tree 1.5 metres wide fell on him. Emergency Dr Luke Delarue believes Dane's helmet saved him.
He was standing next to a tree and cutting it with a chainsaw, and the tree fell the wrong way and landed basically on the left-hand side of his body.
Nurse Elle Greenwood is trying to relieve Dane's intense pain.
Prawns.
That's unfortunate.
He was very stoic. He was really kind as much as he was in pain. Everything I was saying to him, he was responding as well as he could at the time.
Dane, silly questions, mate. Do you know what day it is today?
Tuesday, ain't it?
Fantastic. And do you know where you are right now?
I might be Alfred or Royal Melbourne, one of the two.
Good pick between the two. Royal Melbourne.
Royal Melbourne?
Yeah.
Dr Luke thinks 37-year-old Dane has broken his scapula or shoulder blade.
We just need to figure out what's going on with his shoulder.
Yeah.
We're going to get you around a scan, okay?
I'm worried that he might have a head injury as well. So the only way that I can determine that is to take him through the CT scanner.
The scan will give us all the information, okay? All right. Good man. So he's about to vomit in the CT. Is there if we grab some on-dance?
Nausea can be a sign of a closed head injury. So it makes me wonder, is this because he's actually head injured or is this related to something else?
3, 1, 2, 3, slide.
Over in the CT,
Doing well.
tree lopper Dane is being scanned for potentially life-changing injuries.
Okay, Dane, nice and still now.
The 37-year-old father of 3 had a 1.5 metre wide tree fall on him.
Please breathe in and hold your breath.
So with this mechanism of injury, with something called an axial load, a large amount of force comes directly down through the top of the head and then is transmitted down through the spine.
The force goes straight through your head and just like ripples down your spine, and then some of the vertebrae can just burst.
Emergency Dr. Luke Delarue suspects a broken scapula or shoulder blade.
You can see he's got a fracture in through there.
The scans confirm it.
It's definitely a scapular fracture on the left there. Thanks, guys. On the shoot-through of the scan, I can see that you do have a fracture of your scapula like we thought. It is? Yeah. So we'll have a sit down and we'll have a look at the rest of the scans, okay? Yep. And see what else is going on. He's fractured the scapula or the shoulder blade through there. And up through here as well. Okay. We'll just have a look and see what else.
When a full report of the scans is through, the tally of broken bones gets worse.
Third rib and then fourth rib, you can see should look like this, like a little teardrop shape as he kind of sliced through it. And there's a crack through there. There's another one there as well. This is so third, fourth and fifth rib.
Unfortunately, Dane has broken 4 ribs on the left side.
I'm sorry, mate.
A fractured left shoulder blade or scapula. A broken left arm. 2 fractures in his spine and a broken foot. It's a lot of injury that will be, really, really painful and also take a long time to recover from.
Dr. Luke's long day started with Dane, who was severely injured when the tree he was cutting fell on him.
I'm wondering whether or not you've damaged your scapula, so your shoulder blade.
The 37-year-old father of 3 will need months of rest to mend his broken ribs, spine, shoulder blade and foot. Both Dr. Luke and Nurse Elle see serious accidents like Dane's all too often.
So his actual job is to cut down trees. But arborists, quite commonly you get, like people who are actually up trees cutting down and something happens.
Or they fall off the tree.
Yeah, it's pretty common as well for people just to be at home climbing up a ladder to cut something down or clean their gutters and then fall down as well. Yeah. So falling off ladders and through roofs is really, really common, unfortunately. But,
Trees are dangerous, ladders are dangerous, roofs are dangerous. Anything up high is dangerous. It's a job that I really love and a job that I really, really enjoy on a daily basis.
There's a man coming who's had a fall from a forklift and landed straight on his head. There's always the possibility that this head injury has caused internal bleeding within the head, and that can be life-ending.
Graham, we're going to put the back of the bed down, buddy. We're going to roll. You're not going to move the bed nice and still, but I'll get across up the hospital bed.
When Graham comes in, I see that he is talking, which is an immediate initial sigh of relief, but I can see he's got a very large bandage on his head and he does seem to be in some degree of pain.
All right, so this is Graham. He was in a forklift and it's rolled and he's fallen through the window. It's fallen about 2 metres directly onto his head on really solid ground.
Yep.
Do you feel short of breath?
A little bit, yeah.
Graham was covering almond trees with a tarpaulin when a big gust of wind blew his forklift over and he fell 2.5 metres onto his head.
What we've done, if you're wondering what that is, it's another rolled up bandage actually inside.
Some pressure. Okay.
Pressure got a little bit too much, so we've had to cut up a little bit for him.
Yep. There's some pulsatile blood, so an artery has been damaged and is bleeding. That does cause me some concern because arteries have higher pressure blood going through them, and if we don't control bleeding from an artery, a patient can eventually bleed out from that type of injury.
It's a pretty big fall you've had. We want to make sure that you don't have any other wounds, all right, or any other injuries. We're going to scan you from your head all the way down to your pelvis to have a look at for internal injuries, all right?
What I'm particularly worried about with that type of injury is, have we got a bleed around the brain or damage to the brain or the skull, as well as that artery bleeding?
Hello. Hello. There you go.
Oh, better than you.
Over in Resource Bay 6, word's out that almond farm worker Graham fell from a forklift while at work, and the 64-year-old's phone is running hot.
I can't talk, I'm in hospital.
Yeah, I heard. What's going on?
Who told you?
Probably silly question, but how you doing?
I felt better.
Dad's a old school country boy, doesn't share emotions or doesn't like people fussing over him. People that know him would know that he's got a good heart and he's a good person, but I think the exterior certainly paints a bit more of a standoffish and I'm okay, leave me be kind of persona.
No, he just goes and talking to the kids of it all.
While Graham is downplaying his accident, Dr. Tessa isn't. She suspects a head injury or spinal injuries.
Graham, how this works is I'm going to press down all the levels on your back. You just use your words yes or no if there's pain, okay? Yep.
We're on 3. 1, 2, 3.
Beautiful. All right. Graham, is there pain when I'm pressing up here?
You can't even feel it.
Good.
Oh, yeah.
Yes or no?
No.
You feel me touching here?
Yep.
Squeeze your bottom together for me. Fabulous.
By rolling Graham, the team discovers he's bleeding badly from his bandaged head.
I can actually see that this scalp wound that I thought was the bleeding was under control is actually bleeding down through the pressure bandage and onto the bed.
Yep.
With trauma surgical registrar James May assisting, the bandages applied by paramedics are taken off to reveal what's happened to Graham's head.
So Graham, what we're going to do now, we're going to take this person off the head and have a look at the top, really good wash out.
I'm just cutting the bandage, okay? The scissors aren't going near your skin. They did a tight one.
Good on that. Give me a headache.
I'm not surprised. You just keep your head still for us, Graham. Let us do the work.
As she removes the bandages, Dr. Tessa is astounded at what she sees.
I'm taking the bandage off and I was very shocked and quite confused. I start to pull something away that was red. His entire scalp and skull had kind of been all matted with dirt and was just crumbling away in my hands. And I stood there for a moment looking at it going, I don't know what's going on here.
Oh, wow.
Put mud on it.
Yep.
You did?
No, the other bloke.
They did.
Stop the bleeding.
We might need a bin.
His colleagues on site had actually tried to stop the bleeding by getting the red mud from the farm and patting it in the wound.
I was not expecting that. Yeah, just run some water.
Just a bit of water on you.
Bit cold.
You have to smile at the insane things we sometimes see in emergency. The next thought in my head is if this wound is full of mud, this is a recipe for infection.
Graham, do the stinging now, okay? It's just that injection that you were talking about there.
Over in Resus 6, Dr. Tessa has called on trauma surgeon Dr. James May to clean and stitch the bleeding wound on Graham's head that has been packed with mud.
Luckily, the mud was all on the back and the wound was all on the side. So miraculously no mud in the actual wound, which is great.
Whose hand have I got?
Sorry?
Where's that working for?
You're okay? It's all all right?
It's me,
Oh.
the nurse.
Just a bit of a wash now.
Yeah.
Bit of stinging.
I'm a big man and there's a little hand.
A little bit, yeah. I've got that pressure on.
Just right now.
Sorry, mate.
The skin of the scalp has a very rich blood supply and many arteries supply the scalp. And so any time that the skin is cut in that area, it tends to bleed quite profusely. Graham also managed to sever one of the vessels running underneath the scalp, and we have some arterial bleeding coming from that point. And it's really important that we identify the full extent of the wound because we need to make sure it's clean, and we also need to stop it from bleeding before he goes up to the ward.
You feeling pain or just pulling?
Just pulling and pain,
Yeah.
yes.
Pulling or pain?
All pain.
Pretty hard to see the exact vessel.
See it there.
With these big sutures that we're using to try and stop the bleeding from these particular blood vessels, that they would eventually have to be removed on the ward and revised so that the wound can be cleaned out again and to make sure that there's no other ongoing issues.
Well, that's good. Well done. Well done. You did well. We're going to get rid of all this dirt and stuff for you, give your head a bit of a wash. We're going to have to roll you on your side to do it, and then we'll change over that colour and bandage you up good.
Graham still needs to go to CT to see if he has any other life-threatening injuries.
We've dealt with Graham's acute bleeding from his scalp wound, but I'm still worried that there might be bleeding within the head. I'm worried that there might be injuries of the chest or the abdomen.
Dr. Tessa Smith receives scan results for 64-year-old forklift driver Graham.
We found he's unfortunately sustained quite a few injuries from his fall. The scalp wound that we already knew about, he also has 9 different rib fractures down the left-hand side, and he's fractured multiple bones in his spine as well.
Are you okay? Do you need anything else? No?
Graham's going to need to be seen by the orthopaedic team to make a decision about whether these fractures are stable or whether we are worried about his spinal cord, and then they will guide the management from there.
Dr. Tessa's patient Graham fell 2.5 metres from a forklift and landed on his head.
It's a pretty big fall you've had. We want to make sure that you don't have any other wounds.
After cleaning and suturing the wound, scans revealed Graham had rib and spine fractures.
After talking to the orthopaedic doctors, they've thankfully deemed that these fractures within his spine are stable. He doesn't need an operation and he's safe to walk around. He will have some pain, however, so pain management's going to be really important.
I can't talk, I'm in hospital.
After 2 days in hospital, Graham was able to go home, with his son Tyler hopeful he'll slow up just a little.
I'd hope that it at least makes him think twice about something or situations in the future, but as an old country boy, you can't teach an old dog new tricks, so whether or not it does actually change his approach, you will never know.
As the day goes on, the emergency department is still juggling an unusually high number of patients, and there's barely anywhere to put them.
Is there someone seeing this trauma?
What trauma?
Well, it says there's a guy who's fallen 3 metres coming in here.
Emergency Dr. Maya Kubert is on the hunt for a man who's just arrived after a serious work accident.
I've had a phone call about a 20-year-old man who's had a fall from a ladder. I'm trying to find him and I'm not really sure where he is. You've seen him in the corridor.
The mystery's solved, and Dr. Maya goes in the direction of the patient with Registrar Dr. Matt Bray, who's a proud new addition to the emergency team.
You see it in the specialists I work with in the emergency department, of really great humanists who are practicing emergency medicine with such compassion and excellence and commitment to really getting fantastic outcomes for the patient.
Is this the gentleman that fell off the ladder? Yeah. Oh, go to the CT scanner. They're ready for him. Oh, yeah. Sometimes, weirdly, the imaging department are ready to do things before we've had even a chance to find a bed for the patient. And things don't normally happen in this sequence, but someone's decided that a trauma scan is required and the radiology department is ready to do the scan.
Josh, an apprentice electrician, is fast-tracked to CT because he's fallen nearly 3 metres from a ladder. Dr. Matt is using a special dye to better pinpoint his injuries.
I'm going to put in a drip, this contrast so that we can see all the organs. Make sure it's not bleeding or anything like that. Just worry because you fell from such a height.
The dye is delivered through a cannula, and Dr. Matt relies on ultrasound to guide the thin tube.
I like to think I'm pretty slick at cannulas most of the time, but Josh has took a couple of attempts. In the end, I needed to bring an ultrasound around to cannulate him in the CT scanner.
While Josh goes into the scanner, his girlfriend Meg has arrived at the hospital.
It's very hard not being able to see your loved one, and that's the most stressful thing, is not being able to just be there for them. He doesn't like to tell me what's fully going on, just to make sure that I don't stress out so much. But they have given me a few updates and stuff and kept his mum updated. The main thing is the fact that I haven't been able to see him,
Dr. Matt waits to see what injuries the 20-year-old has suffered in such a big fall.
From the head injury side of things, the CT scan looks okay, so we're just processing the rest of the imaging.
The greatest risk for him is a serious spinal injury that might, result in serious disability for Josh.
Over in the CT, 20-year-old Josh is waiting to find out what damage has been done to his back after a serious fall.
Beautiful. Thank you very much. Happy.
Thank you. Thank you. It'll take a bit more time to sift through the images.
Okay, now it's the waiting game. Yeah. Okay, so as long as you're comfortable, just basically waiting for all your results to come back.
Yeah, that's
okay.
Josh was climbing off a ladder onto a roof when he took that one wrong step.
The ladder was set up and I put 1 foot on the roof, and then my back leg obviously had all the weight of it when I took my leg off to go onto the roof, and then the ladder slid out from the weight, I guess. Gave way and then I fell. Just happened so fast that I just dropped. I tried grabbing on to the roof, but I missed it.
I'm very closely scrutinising the CT scans that look at his vertebrae to see that there's no bony injuries that might result in serious disability for Josh.
I think it's got like 1-2 mils anterior.
Show me the scans.
Dr. Matt gets a second opinion from Dr. Meyer, concerned about what he's looking at.
Is there another view? Ah, holy moly.
Oh, what?
Dr. Matt spots a tiny break that could have been easily missed.
Minimally displaced propulsion into the pipe.
So he's got a fracture through that whole vertebral body, doesn't he?
Yeah.
So you'd miss that if you were just looking at that view.
Absolutely.
But if you combine it with that view... It's really, really nice to work in a team of people, especially registrars who are really keen to do a good job, to give good care, even with the challenges that we've got at the moment that include, you know, examining people in a corridor. I think Matt's done an amazing job.
This is why registrars look at scans, because they pick things. Good for you. Well done.
Dr. Matt can now tell Josh what the pain in his lower back is all about.
Josh, a fall from that height, you put yourself at risk of injuring a lot of things, and thankfully you didn't hit your head.
Yeah.
So, one of your vertebrae gets fractured.
Yeah.
And that the top part of it's just shifted a few millimetres forward.
Okay.
I don't on the face of it think it's going to be something that needs big surgery or anything like that.
It doesn't?
No.
Okay.
No.
Josh will be admitted under the trauma service. He's going to need input from the orthopaedic spinal surgeons who will know precisely what precautions he needs to take. Thankfully, Josh has come away all right. Yeah, be careful out there on the ladders, people.
Dr. Matt's patient, Josh, fell nearly 3 metres at work.
So I was getting on a roof of a spray booth, and the ladder was set up, and I put 1 foot on the roof, and then the ladder slid out, and then I fell onto my lower back.
Josh was lucky to escape major injury.
One of your vertebrae gets fractured.
Yeah.
I don't on the face of it think it's going to be something that needs big surgery or anything like that.
Josh is slowly recovering, but it'll take some time before he can return to work. In the ambulance bay, paramedics are arriving with a young tradie who's had a shocking work accident.
Hit the side of the head with a piece of timber. Yeah, this hurts like...
Lachlan dropped a 160-kilo concrete block onto a large plank that catapulted directly into his face.
We tried to get you down into the room.
Treating Lachlan is emergency registrar Dr. Katrina Moynihan, who's been away from her home in Ireland much longer than she intended.
When I arrived, I just actually planned on coming for 1 year, and then 1 year turned into 2 years, and almost in the blink of an eye, it's been 8.5 years. The best thing about emergency medicine for me is it's the variety. I love that every day is different. I'd be lying if I said I didn't enjoy the adrenaline rush from time to time, I think. You have to be relatively comfortable in some degree of chaos.
Hi, Lachlan. I'm Katrina. I'm one of the emergency doctors that's going to look after you, okay?
Understandably, Lachlan is really upset. What I'm trying to do is just to reassure him that he's in a safe place and that we're all here to look after him. Calming him down and just reassuring him that he's going to be okay, I think, is a really important first step.
We'll look after you. You'll be okay, all right?
This is Lachlan. Sustained a whack to his cheekbone. He's got deformity to the left side of his face and to his nose. The pain to his left side of his neck is quite severe.
How's your pain at the moment? Where is it the worst? On your face, your neck, your head?
A mix.
A mix?
This way, the side of my nose.
Yeah.
There.
Yeah.
Across to my cheek.
Yeah.
Lachlan's in a lot of pain. Giving him some strong analgesia or anti-pain medication is really, really important. We want to make him comfortable and take away as much distress as possible.
Do you want to just get some fentanyl?
Fentanyl? Yeah.
We're going to give you some strong pain relief into the drip, and we're going to need to have a look at what damage has been done to your face.
Like all cases in the ED, everything is documented. It's Nurse Gemma Hodgson's turn to be scribe.
We are constantly documenting, and it might be every couple of seconds we have to write something. If the wrong information is documented, you could have medication mistakes that potentially could put the patient at risk.
That's about it, really. I'm just going to have a little peek of... Yeah, I'm so sorry.
The catapulting plank has struck Lachlan dangerously close to his eye.
There's actually quite a bit of swelling.
One of the worst case scenarios would be that if there was a fracture there, that the muscles that control the movement of the eye can get entrapped. And that would mean that Lachlan's eye would no longer be able to move normally.
And just a little bright light, okay? Good job. That left eye, Lachlan, can you see out of it?
No, they're not lining up anymore.
Yeah.
Lachlan tells me that his vision from his left eye isn't normal. I'm really concerned about what that could mean for Lachlan.
You've got a lot of blood on your hands, but I'm pretty sure that's all come from your face.
Across the corridor, tradie Lachlan has shocking facial injuries after being struck in the face by a plank at work.
All right, I know.
His left eye took much of the impact.
What were the pupils?
They're like a 2, it's a bit sluggish.
So biggest concern, obviously, with his potential eye injury is that he actually may lose or have impaired vision, which, being a young tradie, obviously can be life-changing.
I'm just going to change to a rigid collar. You don't have to do anything, and I'll be holding your head, okay?
And in spite of strong pain relief, Lachlan is still in agony.
Any difference with the pain relief that I gave you, or?
Oh, it sucks.
It's going to give him a bit more fentanyl, Katrina.
Yeah, thanks.
Another 25, Nash?
Another 25, yeah.
I've just got to document the last 2.
Nurse Gemma is keeping on top of all the medications Lachlan is receiving.
Lachlan's had quite a lot of pain relief already with the paramedics. We need to make sure that we're not giving in excessive amounts.
Is it 75 he's had?
Yeah.
All right, all your fentanyl's up to date.
That ears are ringing like...
Can I just have a very quick look in his ears?
The strike and the ringing in his ears is a warning sign to Dr. Katrina.
And I'm just having a little look in this ear. And do the same on the other side, okay?
My immediate concern, there's something going on that's more significant and more serious that we can't appreciate just on first look.
You said your hearing is bad on the other side.
The ears are ringing on both sides.
Okay, all right. And you didn't fall backwards, did you, when the wood hit you? Did you stay standing up?
Yeah, I know.
That's all right. Do your best to relax. You're okay.
If a person sustains damage to their brain as a result of a trauma, then they certainly can have a seizure disorder as a result of that, and potentially that could continue long term.
We're going to need to arrange some scans for you, okay? Do you feel nauseous right now?
Not particularly.
No. If you start to feel nauseous, so just let us know early, okay? Do you live by yourself or?
No, Dad.
With your dad, okay. Does your dad know that you're here? Do you want me to give him a call?
You want him, he knows.
He knows, okay. No trouble, no trouble.
Lachlan's dad is rushing to be by his son's side as he heads to CT. While being scanned, Lachlan takes a turn for the worse. It's a dangerous situation. Lachlan could choke because he's on his back and unable to move.
Are you right, Lachlan?
The team has only moments to move him onto his side.
The vomiting in the CT scanner is potentially due to the impact that he's had to his head and also the strong pain relief that Lachlan has required. Unfortunately, the side effects of those medications is nausea and vomiting.
Lachlan is now safe to go into the CT, with Dr. Katrina monitoring the results.
He's sustained a fracture to his left cheekbone, to the bones in his nose, and also the socket that supports the eye. Lachlan is going to need surgery to stabilise those fractures. I think overall he's been incredibly lucky to not have sustained any more significant life-threatening injuries.
Tradie Lachlan arrived at the Royal Melbourne in agony after a freak accident on a construction site.
Hit the side of the head very close.
We'll look after you. You'll be okay, all right?
As well as dealing with his extreme pain, emergency Dr. Katrina was concerned for Lachlan's eye, only centimetres away from the massive impact.
That left eye, Lachlan, can you see out of it?
No, they're not lining up anymore.
Yeah.
After a night of rest and pain management, Lachlan is already feeling a lot better. The accident happened just before work stopped for the day on the building site.
I was carrying a concrete sleeper, I weigh about 160 kilos, with another guy, and I accidentally dropped it on top of a piece of timber and flicked up and hit me straight in the side of the head. Took me off my feet.
Lachlan's recovery will continue over a period of weeks, so we know that he will have to have surgery to fix that fracture to the left side of his cheekbone. But all going well, I would expect Lachlan to make a full recovery.
With his surgery still a week away, Lachlan's looking forward to some TLC from his mum.
I think my mum will probably come and pick me up. I'll just chill at home, Panadol, put some ice on my face. Hopefully the swelling will go down quick so I can get in and get it fixed and look pretty again.